Schools in Alberta do remain closed, while some schools in Quebec have reopened, and BC plans to reopen schools June 1st. Ontario Premier Doug Ford, meanwhile, announced today he's not going to, quote, chance it.
It is clear that we cannot open schools at this time. I'm just not going to risk it. This wasn't an easy decision to make, but it was the right decision. We've made the decision to put our kids' safety first, and at the same time, we have a plan to ensure that our children's education can continue outside of the classroom. At-home learning will continue. All students from grades K to 12 will receive their report cards.
The province has also canceled overnight summer camps. So with more people returning to work, what are parents supposed to do about childcare? Ontario's Education Minister Stephen Lecce joined us earlier today from Toronto to discuss his government's decision. Hi, Minister Lecce. Good to see you again.
Thank you so much.
Minister, the Premier kept saying today when asked about reopening schools, I'm not going to chance it. I'm not going to chance it. Did you get explicit advice from public health officials not to reopen schools this year?
You know, the Chief Medical Officer of Health in Ontario and the COVID command table in Ontario gave us guidance that the right course forward is not to reopen schools in June. The decision point was made in following consultations with Sick Kids as well, which is obviously a preeminent center of research and excellence in medical support for kids. And so that's the guidance that drove the decision. When it comes to our calculus, we also appreciate that there's only a limited amount of weeks left in the school year. And so we think parents, while difficult for kids, want us to make sure that safety remains top priority. That's what we've done today in this decision.
Help me understand the guidance as it relates to some of the other measures your government has taken. I'm thinking, for example, today, many businesses, storefront retail businesses can reopen in Ontario. Why is it okay to chance that, but not to chance going back to school?
Well, we have a staged recovery plan, and we also acknowledge that there's got to be a methodical, thoughtful, and slow, return as part of our plan to ensure economic recovery. We want to do that, but we cannot in any way undermine the gains we have made as a province, and I think broadly as a country when it comes to flattening the curve. That's why we are taking a staged approach. In the first stage, we have emergency childcare, for example, that's supporting our frontline workers. 1,600 kids a day on average are being supported. But in phase two, our plan, we're giving warning to the market and to parents that we are going to start to build up and scale up to have a childcare available for the labor market. And with that comes a responsibility for the operator to fulfill the highest levels of safety. We've set out, currently there are regulations in place for emergency childcare, and those are being followed. Every single staff member has to be tested. There's screening protocols. No person could enter other than the child or the worker. There has to be a plan, a COVID outbreak plan that is approved by the local health authority. I mean, we have very strict protocols. We have absolute expectation of compliance. And I think we can do this, but we just need a bit more time to get to the point where the health team tells us that the data is moving in the right direction. We can start to reopen the economy and, of course, reopen childcare. That's an important prerequisite for it.
I do want to challenge you, Minister, just on the premise of it being methodological, and just to a certain degree, insofar as, for example, I work in a retail store. I go back to work today, or I'm supposed to go back to work today. You talked about a phased approach for childcare. Unless I'm an essential worker, I don't have childcare right now, and I won't until the next stage at the earliest. Is it
right?
Like, to some parents, that's not going to be easy right now, and it doesn't feel very methodical.
Well, let me just, fair enough. And what I will tell you, though, is that an option for all parents through this outbreak, and of course thereafter in the coming weeks, is home-based childcare, which is, of course, is not in any way undermined or negated as an option for families or the market. That continues, and we're encouraging people to do that, knowing that it is working. We're also, as we look forward in the coming weeks, get to a stage, hopefully, with the medical data on our side, to allow us to expand, to give that relief so that parents that could return to the labor market as they're being asked to, as the economy sort of returns to some element of new normal. And the final point is just with respect to the summer. Look, I know, Vash, I think it requires us all to acknowledge this is not easy on a parent. I mean, I hear your point. I think a lot of people can be in this awkward middle place, and the data, the health imperatives got to guide our decisions. And that's why we've done that. But we've also given the signal an element of positivity on the horizon. Childcare will reopen in reasonably short order, we hope, with new protocols. Day camps, summer day camps will reopen. That will enable kids to have that support they need by day, gives their parents the relief they need to go to work. And of course, we have a summer learning program, which will also capture hundreds of thousands of kids to be busy in an academic experience this summer, should they be interested on a voluntary basis. So I hear you on the immediate term. We're building up to that based on the data, but we've got to make sure health remains the single driver of our calculus when it comes to the lives of our kids.
And on that, Minister, how are you going to be sure that the data supports even reopening for summer school? And I take your point that it's voluntary. But right now, there's a lot of questions about the data coming out of Ontario, primarily driven by, for example, very low testing numbers in just the last 24 hours. I know not always so. There are days when there are high numbers there, but it's not consistent yet. How can parents be assured that it's safe to send their kids to summer school with the kind of data gaps that we're seeing right now?
Well, what I would say is this province has, on a per capita basis, we are leading the nation in testing. And with respect to today, Monday, historically Monday, there's a lag in testing, not a new phenomena. It's largely just the results of, all the various health authorities providing data, and it takes a few days to get uploaded on the Monday. Nothing unusual there, but I hear you that, data and public confidence in the data is going to be critical. And so what we're going to be doing is building out a plan and a framework for everyone, for parents, for our educators, for our support staff, and of course for the kids to know what will enable that reentrance. And what I've committed to doing when it comes to September, which is the big sort of next opportunity for students to enter beyond the voluntary openings in the summer for summer school, is to communicate transparently with the public a plan for reopening before the end of this school year for September. And I want families to know that that plan is going to include new protocols, new guidelines, new spacing, new restrictions, and a new world. We have to reimagine education in many respects. But one thing I need to make the case for is the strength in technology to help deliver education as an offset when we can't be in class. And don't get me wrong, Vashi, it's so much better to be in class for our parents. Our kids know it. They need that human connection. But in the absence of that, if we cannot safely send them back to school, then we have a duty, all of us, to up our game to improve the live, dynamic, synchronous experience of learning. I just joined a class. I've been joining classes, learning English and French from these kids, and I see their interaction with their teacher. They hear that voice, see their friends. I know it's virtual, but honestly, it makes a difference. And that's why we have to, between now and September, continue to expect as much as we can for our kids so that they get the best experience out of a very difficult time.
What happens in September if there is a spike? There are fears now that there could be a spike in cases in the fall that are a resurgence of the virus. What happens if the data doesn't continue in a downward trend? Are you willing to revisit the idea that schools will reopen then?
Look, we are going to be responsive to the public health advice and to the data. Certainly, our aim is to allow and enable students to return to class in September. It's got to be safe to do so. But our hope is to do that. And what I've heard from a lot of doctors and advisors is that there's a social-emotional impact to not having kids in school. So balancing the imperative of them socializing and learning and, the collegiality that comes, the friendship that can be bud from being with each other, but also realizing that we got to keep them safe from the virus. And so our plan is to have students back in schools in September. But I obviously will be persuaded by the data. I mean, if there is that type of shock, that type of increase, and I think the public health table will have advice to cabinet. So far, our hope is we're going to continue to take action in Ontario to flatten the curve, reduce the impacts, and obviously move that trajectory down so that we can reopen the economy and ultimately start to get these kids back to a more normal experience, both in camps and schools and the playgrounds right across the province.
With respect, Minister, is there a benchmark? Is there a specific benchmark you can tell parents right now? AKA the cases will be below this number. The number of new cases will be below this number. I just feel like it's very abstract for parents right now to know how your government is making these decisions. What benchmark do you have to hit in order to decide, okay, it's safe to reopen these schools?
Yeah, we're going to be unveiling the full spectrum of allowing students back into schools, the whole plan around reentrance by the end of this month. That type of data and information could be available in that announcement. Right now, I think what I'm telling people is that based on the advice of our medical and scientific experts in this country, that we cannot, in our estimation, responsibly allow children back in schools with respect to September and beyond, I understand your question, and I'll be able to report on those details by the end of June, so that parents just know with certainty what the classroom is physically going to look like, what the spacing is going to be, what the new guidelines are going to be for gym, for recess, for lunchrooms. There's a lot of decisions and a lot of consultation. Parents, educators, support staff, all of you have a say, students as well. And please know that we've also launched a process for consultation. But for students that or parents want to have a say, I'm encouraging them to go to our Learn at Home website and share their perspective on what those metrics should be, what those protocols should be, to give them confidence that their kid could return in September.
Based on what we've seen in other jurisdictions, just before I let you go, Minister, the classes have a lot less kids in them. There's got to be more classes, but fewer kids in them. You took, and your government took, a lot of heat for class sizes and the funding associated with it. Is your government prepared, if it needs to, expand the number of classes or the number of teachers to supply extra funding for education if necessary in September?
Yeah, in this negotiations we just reached with all the unions, which we're proud of. We in fact froze classroom sizes from last year. But having said that, I think you're right that there may be requirements imposed, for example, by the health officer of how many persons or pupils or kids really can be in a class. So that will have to change the decisions of government of how schools operate. And so I'd say all things are on the table when it comes to ensuring safety. That is for sure. But I want to allow people and our federation partners, our boards, our parents to have a say before prescribing a solution or an outcome. I think what's immediately important is that kids will graduate this year. They will receive a report card this year. They will receive mental health supports at an enhanced rate. And we're going to build up our summer learning program. We're going to open up childcare when it is safe. We're going to have summer camps to enable kids to have that experience and for their parents to enter the labor market. And we're going to build a credible plan following the advice of our medical and scientific leaders in Ontario to reopen schools, including benchmarks and data that I think will create some confidence that Ontario is leading in this respect to ensure kids can return in September, as we believe they should, but with new safety regime in place that keeps them safe.
Okay, Minister, I'll leave it there. Thank you for your time.
Thank you.
We're joined now by Dr. Isaac Bogoch. He's an infectious disease physician and clinician investigator at the Toronto General Hospital Research Institute. He joins us from Toronto. Hi, Dr. Bogoch. Great to see you again.
Good to see you as well.
I have a ton of questions about schools in Ontario, but I've got to start off with that news out of BC. Just 2 cases, the lowest since March 7th. Just your initial reaction to some of the successes that British Columbia has had.
It's amazing. It's just amazing to see. There's so much hard work and effort that's been placed into flattening the curve and actually getting a sustained reduction in the number of new cases per day. And then you get a day like that. It's definitely, it is okay to pause and celebrate the successes along the way. We know that it's not over. We know there's still a long way to go. But, good for them. That's wonderful to see. And as they're reopening, and if they can do so in a much safer manner, knowing that there's just less and less community transmission of COVID-19 in that province.
I'm glad you framed it that way, because that's sort of the backdrop against which I want to ask you the questions in Ontario. Because while the total number of cases is lower than it was, for example, a few weeks ago or a month ago, we're still a lot higher than 2 cases in this province here, at least, than 2 cases a day. And we're also seeing great fluctuations in the level of testing. So the goal is 20,000. We saw I think it was 5,813 in the past 24 hours. The day before, just over 9,000. What is your sense of how confident we can be in the safety of reopening in Ontario?
I think we have to be much more cautious compared to a place like British Columbia or New Brunswick. But, in the same breath, I think we can at least start that process in a very slow manner. Of course, we still need impeccable diagnostic testing and access to diagnostic testing. We need very rapid contact tracing. We need surveillance in place. And I'm not entirely sure we have all those components in place just yet. We certainly have some of those components, but we can improve on those fronts. Having said that, we can likely start to slowly reopen and expand on those fronts simultaneously. The key thing is we'll have to expand on those fronts simultaneously. And if we don't expand on our diagnostic testing, our surveillance, or improve our contact tracing, it would come to no one's surprised that we might see a spike in cases, and it might take longer to identify them. And we might need to actually regress and clamp back down and place some more public health restrictions rather than move forward with opening the economy here.
What kind of role does the federal government have to play where contact tracing and even the overall testing levels are concerned? And I ask because the Prime Minister talked today about helping provinces increase capacity. I know we're in this, federation where there are major jurisdictional issues, but it's not like the federal government has said, okay, this is the amount of contact tracing we have to do, or we have a goal of 60,000 tests. We're only halfway there. What should the expectations of the feds be?
It's tough to know. I mean, they're certainly setting the tone, and they set the tone for the whole country. They can set general guidelines and make general policy recommendations, but clearly the implementation is at the provincial level, and actually the real implementation, where the rubber hits the road, is at the public health units, the diagnostic testing centers, the hospitals. But the federal government they certainly set the tone, and they can provide funding and support for programs that are going to be run at a provincial level as well. They can also help coordinate across all the provinces. So, for example, all the provinces are reopening to some extent. Some are clearly reopening more than others, but there was coordination amongst the provinces, and that was led by the federal government. So, it is helpful, and it is helpful to have this coordination between the provinces that's led by the federal government.
Let me ask you also about this decision. I know so many parents are watching right now from the Ontario government about keeping schools closed throughout the remainder of the school year. Was it the right call from your perspective?
Personally, I think so. I mean, I get it that there's a lot of different opinions here. I also appreciate that schools provide a lot more than just education. They provide, food, safety, security. They enable parents to go to work to provide for the family. I completely understand that schools do a lot more than just teach children. Having said that, given the community prevalence of COVID-19 in Ontario, and that we're not having, the numbers of new cases per day like British Columbia or like New Brunswick, I think it was a safe decision. I really think it was a fair decision. There's still too many unknowns. And I think by reopening the schools, you just set up a situation where you can make matters worse and certainly contribute to greater community spread of this infection. I think it was the right choice. I appreciate that there may be some who disagree with me. That's okay. We're all looking at the same data, and we can come to different conclusions. But Premier Ford really said he doesn't want to put anyone at risk, including children. I'm with him on that.
Is there any incongruency to the idea that retail stores, for example, are open, or you can have a housekeeper right now in Ontario, but it's too much of a chance to send your kid to school?
Yeah, a little bit. But remember that these rules are really gradual, and, retail stores have a lot of restrictions on them. So, for example, they can't open up in a mall. They can only open up if they have a door that's facing the street. They have to restrict the number of people that are in there per day, at any given time. They have to protect their employees. They have to protect their customers. Many of them have plastic shields in place to protect employees where they pay. There's hand sanitation stations. There's a lot of safeguards in place to really protect individuals in these businesses. Schools are a little bit tricky because you're going to have hundreds of kids under one roof, and there's only so much space that you have in a school. I appreciate that you can be creative and maybe put desks up in a gymnasium. You can have hand sanitation stations. I think it's just a much harder setting to control compared to small businesses. But at the end of the day, you know what? We don't know. I mean, it's impossible to know. We have to move forward. We're going to move forward with this. Let's see how it goes. And there's always a chance that we can pivot along the way. We can continue to reopen the economy if things are going well. We might regress if things are not going well. Policy can change in real time that's adapting to new data. I think that's completely acceptable.
Okay. Thanks so much, Dr. Bogoch. Appreciate your time and insights as always.
Anytime.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.